Type 2 diabetes in our golden years, the unexpected power of berberine. Good morning, my dear patients. Today, I want to talk about something that affects nearly 3 in 10 people over the age of 65, type 2 diabetes. And I'm going to reveal a natural ingredient that can be a powerful ally in controlling your blood sugar, berberine, the reality of diabetes at our age. First, let's understand the situation we're facing. Over 29% of people over 65 have diabetes, and millions across the country are living with this condition. What worries me most is that 4 out of every 10 adults with diabetes don't even know they have it. At our age, diabetes can be quieter. We often mistake the symptoms for normal signs of aging. That persistent fatigue, wounds that heal more slowly, infections that keep coming back. But this isn't normal. These are signs that our body needs attention. Type 2 diabetes occurs when our body can no longer use insulin properly, like a key that doesn't fit the lock anymore. Over time, this can lead to serious complications, problems with our eyes, kidneys, nerves, and heart. But the good news is that there's a lot we can do to manage this condition. The unexpected ingredient, berberine. Now, let me introduce you to something that might be a surprise. Berberine. It's not a magic pill, but a natural compound extracted from plants like golden seal and Oregon grape, which has shown impressive results in controlling blood sugar. When I mention berberine to my patients, their first reaction is, "Doctor, I've never heard of that," and that's precisely why it's our unexpected ingredient. Berberine is backed by scientific evidence so robust that in clinical studies it has shown an effectiveness similar to metformin, one of the most prescribed medications for diabetes. How berberine works in our body. Let me explain simply how it works. Imagine our body is like a house with many doors. Berberine acts like a very efficient janitor with a master key who opens the right doors. It activates a protein called AMPK, which is like the energy manager of our cells. When activated, this protein helps our cells use glucose more efficiently, closes the problem doors. It reduces the liver's excessive sugar production, especially overnight, when we typically don't need as much energy. Improves communication. Berberine helps our body respond better to insulin, as if it were improving the conversation between the hormone and our cells. The scientific evidence that convinces me as a physician, I need solid evidence, and berberine has it. A meta-analysis of 28 clinical trials showed that berberine significantly reduced fasting blood glucose, glycated hemoglobin, HbA1c, by 0.73%, blood sugar spikes after meals. To give you some perspective, this reduction in hemoglobin A1c is clinically significant. It's the kind of improvement that can prevent long-term complications. Safe and effective dosage. The dose that showed the best results in studies is 500 milliliters 3 times a day before meals. It's important to take it before meals because berberine works best when carbohydrates are being absorbed. Some of you might experience mild intestinal discomfort in the first few weeks. This is normal and usually subsides. It's a sign that berberine is starting to work in your digestive system. Safety for our age. One of the things that reassures me most about berberine is its safety profile in older adults. It doesn't cause the dangerous hypoglycemia that some medications can. It doesn't overburden the kidneys, and it doesn't cause liver damage, all major concerns at our age. In the studies I've reviewed, berberine was well tolerated by elderly individuals with minimal and reversible side effects. Other natural allies that work. Besides berberine, other natural ingredients can also help. Prickly pear cactus, nopal. This plant has special fibers that reduce sugar absorption. About a cup of cooked prickly pear with meals can reduce glycemic spikes by 20%. Guar gum, a soluble fiber that forms a gel-like substance in the gut, slowing down glucose absorption. Studies show that 10-15 g per day can lower hemoglobin A1C. Apple cider, vinegar, just 1 or 2 tablespoons before meals can reduce sugar spikes by 20-30%. The acetic acid in the vinegar slows the digestion of carbohydrates. The importance of a complete approach. I want to be clear, berberine does not replace your prescribed medications. It is a powerful supplement that may help you need less medication or achieve better glycemic control. Managing diabetes in our golden years requires a gentle yet effective approach. Proper nutrition, rich in fiber with enough protein to maintain our muscle mass. Adapted physical activity, even a 30-minute walk makes a difference. Medication, when necessary, used without fear but with medical supervision. Natural supplements, like berberine, when appropriate. Realistic goals for our age. For those of you who are healthy and independent, we aim for a hemoglobin A1C between 7.0–7.5%. For those with more health challenges, a range of 7.5–8.0% is often suitable. The key is to avoid both dangerous highs and lows in blood sugar. Recent discoveries that excite me. Science never stops, and we have some exciting new findings. Recent studies show that early nutritional interventions can even lead to diabetes remission in some cases. We've also learned that meal timing matters. Eating earlier in the day helps with glycemic control. My practical guidance. If you're interested in berberine, here is my advice. 1. Always talk to your doctor before starting any new supplement. 2. Monitor your blood sugar more frequently in the first few weeks. 3. Start gradually, perhaps 500 milliliters once a day, then increase. 4. Combine it with lifestyle changes, diet and movement. 5. Be patient. The benefits typically appear in 2 to 3 months. A final message of hope. My dear patients, having type 2 diabetes at our age is not a sentence. It is a condition we can manage with wisdom, science, and the right tools. Berberine represents one of those tools. Natural, effective, and safe. Every blood sugar level we control today is an investment in our quality of life tomorrow. Every mindful food choice, every walk, every pill taken on time brings us closer to a healthier, more independent life. Remember, you are not alone on this journey. Science is on our side, and ingredients like berberine prove that nature still holds powerful secrets for our health. Take care of yourselves, monitor your health, and don't hesitate to ask for help when you need it. Diabetes may be a part of our lives, but it doesn't have to define them. Important note, this monologue is based on current scientific evidence, but any change in your treatment plan must be discussed with your primary care physician.